Welcome to day 2 of the impact of the Russia-Ukraine crisis on children and vulnerable households in Egypt. Yesterday, we had a very rich discussion with fellow academia, people from academia, to look into our plans for this fantastic work that you're going to hear about shortly from our colleagues. Today, we're really keen to look into it a bit more with the policy makers and the policy influencers from government and development partners. Without further ado, just a warm welcome to everybody who's joined us in person and also those who are joining us online. And I give the floor to Dr. Ibrahim Badawi, Managing Director, ERF, for the initial welcome remarks. Dr. Ibrahim.
Thank you very much, Dr. Shireen. Let me first welcome His Excellency, Dr. Tarouk Tawfiq Amin, for his presence with us in this important second day of the event. And I would also like to welcome our colleague, Mr. Jeremy Hopkins, UNICEF representative in Egypt, and his colleagues from UNICEF, and all other participants and contributors, speakers and commentators. I was in Sudan and came late last night, and the same issues when I was reading the agenda also figured in the discussion that we have had. So it seems to me like the impact of the war on Ukraine and the consequences for the cost of living, especially on food issues, but also other sectors, for example, for the case of Egypt, like services and tourism, are very critical issues that are affecting entire economies in our region. And in fact, it tests also the capacity of our institutions, macroeconomic institutions in terms of responding to shocks, but even more importantly, social safety net institutions. And certainly the cash transfer system in Egypt is very important in this context in particular, in order to respond to this shock for the vulnerable segments of the community. But also, I think, thinking about the future and also the potential impact these kind of shocks will or might, in all likelihood, will have on the cohesion of our society. This is also a very important dimension of the inquiry, of the research component of this project. And of course, it's very important, this research, to be communicated, and that's why this is the second day. And we at the Economic Research Forum, we really welcome this kind of policy-oriented research that is based on rigorous analysis of bona fide databases and testing hypotheses. And we would really appreciate this opportunity of being part of this. And we would look forward really to collaborate and to mainstream our partnership and cooperation with UNICEF. So once more, I would like to extend my thanks and appreciation to everybody and look forward to continue the conversation and the cooperation and the discussion. Thank you very much.
Thank you, Dr. Ibrahim. I have not introduced Dr. Ibrahim formally. Dr. Ibrahim Al-Badawi is Managing Director of ERF, so I always feel that this is enough, but to do fairness, he's also former Minister of Finance and Economic Planning during the period of the 2019,
2020.
yes, 2019, 2020. And a core element that Dr. Ibrahim had brought to the ERF strategy has very much been bringing the policy perspective in focus. So the whole aspect of policy dialogue, even from the outset, setting the right question, creating the dialogue, looking into the different partnerships with the different stakeholders has been a key aspect. So it's always a pleasure seeing that implant really flourishing. Yesterday, we had a chance with our colleagues from UNICEF that we talked a bit about the partnership and what we're trying to achieve. So I would like to give the floor to Mr. Jeremy Hopkins. And when I introduced him yesterday, I said he's a man of the world. He's a global citizen with being half Kenyan, half British, and with a fantastic track record in matters related to children, from working in Somalia, managing programs in the field of child protection, youth engagement, children affected by HIV and behavior change communication. He worked in child protection in Mozambique with a specific focus on HIV. And worked also as the deputy representative for the UNICEF in the Central African Republic, Yemen, and Somalia. More recently, is also the representative acting as representative for UNICEF in South Sudan, and has completed his tour of duty as UNICEF representative in Burundi in August 2020. Mr. Jeremy Hopkins, UNICEF representative in Egypt. The floor is yours.
Thank you very much for the introduction. And Dr. Ibrahim, Dr. Tariq, Shireen, and Dr. Shireen, Dr. Yasmin. I was here yesterday, but it's a great pleasure to be here again today. Also great to see members of the different ministries with whom we work, and some colleagues from the UN. And of course, we have our UNICEF team here, and also regional expertise and from UNICEF. And of course, we have the UN Resident Coordinator's Office with us here today. So a really great group of people. And I particularly want to pay tribute to Dr. Tariq, who until last week was wearing the double hat of chair of the National Secretary General of the National Council for Childhood and Motherhood. So really a very appropriate person to be here with us today. So thank you for joining us. I'll just say a few words by way of introduction to the topic. Egypt got through the COVID pandemic from, economically rather well, although we did see, a number of indicators of concern during that period. But no sooner are we out of that than we are into the next crisis, which is that which we're here discussing, the impact of which we're discussing today, which is the crisis that has been precipitated anyway by the war in Ukraine. Which has been accompanied with a rapid increase in oil prices, fertilizer costs, unprecedented inflation in many countries, and most importantly for our purposes, a rising cost of food and other essential commodities. WFP has estimated that the number of people suffering from acute hunger due to this crisis will increase by almost 50 million, and that includes 6 million people in this region. This is having and will have a disastrous impact on children, who are always amongst the most vulnerable in a food price crisis or food crisis. The most recent family health survey had seen improvements in particularly on nutrition indicators, wasting and stunting, quite very positive improvements. We saw a decrease in the stunting rate from 21% to around 13-12%, and wasting was also down by more than half. But you can be sure that one of the first indicators that will deteriorate now will again be nutrition indicators. And even if we have a stunting rate of around 13%, just to put that into millions, if we have 40 million children, 13% of 40 million children is almost 5 million children. And those children's lives are permanently damaged by stunting, and that damage is done by the time they are 2 years old. They are too short and their brains are not fully developed for the rest of their lives. So there's certain urgency to this discussion. The World Bank has estimated that for every 1 point increase in food prices, we will see 10 million people fall into poverty. And in this region, so worldwide, that's looking around 100 million. And this in this region, it's almost 3 million. The increase in food prices constitutes an even bigger threat, as usual, to the poorest and most vulnerable households. As you know, probably the poorest households will spend almost 50% of their income on food. If you put that against the increase in food prices, the implication is alarming. And again, we're in a country which imports the majority of certain foodstuffs, and that means Egypt is also particularly vulnerable. The simulation by IFPRI to measure the impact of the increases in food, fuel, and fertilizer prices on household consumption has found that Egypt's national headcount poverty rate is expected to increase by about 1.8%. You will recall that recently we were able to celebrate a small celebration, a decrease in the poverty rates in Egypt. That was just before Corona, certainly before this current crisis. So we are expecting to see some reversals, unfortunately, in poverty rates here. Monetary, fiscal, and social policies need to consider these negative consequences, which risk rolling back, which will almost certainly roll back some of the advancements that we have made in Egypt and globally in human development and against the SDGs. And then our care and concern is for the most vulnerable households and for children. So that's why your inputs into this discussion are so important today. And, you know, there's limited fiscal space, but there is fiscal space. And we have to look and see how we can increase the efficiency of our spending in those essential services, which are so important for children at a time like this. And I'm talking about access to health services, nutrition, education, social protection, child protection services. I have to just mention, I'm wearing an orange tie. We're in the 16 days of activism against gender-based violence. But even those kind of indicators are at risk of deteriorating in such a crisis, which impacts on poverty. These 2 days are important for us. There is, policy is made based on good research and good data, and I'm so pleased that we have this partnership with you. It's a new one for us, and we're really very pleased to be working with you. And thank you, Dr. Ibrahim, for your leadership. We hope it's going to yield, even better quality discussion inside the UN, with government, and of course with all actors who have an interest in the Sustainable Development Goals. I also want to mention that this partnership is part of a broader UN partnership, which is led by the Resident Coordinator's Office. So I'm pleased that we have colleagues from that office with us here today. And the results of this work will also go beyond UNICEF to the rest of the UN, specifically WFP and IOM. We're working on this together. It's something called the SDG Fund. This is all about how we can ensure we don't lose traction or are able to mitigate the impact of this crisis on advancing the SDGs. Egypt's been doing so well on the SDGs, and we don't want this to set us back more than it must. And so hopefully these discussions will give us some policy options that we can use with government, as UN agencies, as other actors, and ensure that keeping children at the center of as the focus and at the center of the discussion, we're able to keep moving forward with the Sustainable Development Goals. With that, I will stop, and thank you very much.
Thank you very much, Jeremy. Well, today we have a very solid agenda. It's in two parts. The first part, it's going to be session one is going to be evidence from the policy paper, the policy interventions aiming to offset the impact on the crisis. And I'll be introducing shortly our colleagues who will be presenting that. Following that presentation, that would also refer to the key takeaways that were taken on from yesterday's roundtable. We're going to have the session two, which is very much a panel on policy making in the face of the crisis. And that would be moderated by Mr. Saman Thapa. And I must say, at the outset, thank Dr. Ibrahim and Jeremy for making that introduction, and mention that I'm glad, Dr. Tawfiq, you're joining us. We are in the perfect position between the two. So really lead in with whatever discussions I hope you'd be joining us for the full day and giving us the wisdom of the thoughts and the plans that are made for policy. What I'd like to do is now introduce our colleagues, Dr. May Gadalla. Dr. May Gadalla is our data statistics manager at ERF and also associate professor, Department of Statistics at Cairo University. Both her and Dr. Nisma Mamdouheimer will be, who's the senior statistician at ERF, would also be presenting us with the main findings. So to set the scene. May, the floor is yours. Thank you.
Good morning, everyone. Thank you for joining us today in the second day of this 2 days workshop. Let me first give you a brief about what happened yesterday in the first day. Actually, we discussed the paper, we introduced the draft of the policy paper, and we had a very fruitful discussion with the professors and researchers from yesterday. Dr. Sheen Shawarbi, actually, she discussed our paper. She had several great ideas that can be incorporated into the paper. Dr. Hiba Lethi, Dr. Shahir, and Dr. Allison, they also joined us in the discussion, and they had very fruitful recommendations. Let me give you a brief exactly about what they talked about. Dr. Allison, she talked about the global lessons and policy practices that could be applied to the Egyptian context. In addition, Dr. Heba discussed the impact on cost of living, especially in relation to food and commodity prices, and to what extent it affected the population in Egypt. And in terms of policy measures, how can the existing of social protection system play a role in protecting the vulnerable households in Egypt? Dr. Shahir, he discussed actually the macroeconomic, the resilience of Egypt to the macroeconomic, at the macroeconomic level, macro and microeconomic level. We had great actually recommendations. Let me give you a brief about the recommendations that we have received yesterday. One of the main things that we discussed yesterday about investing in education and health and human capital infrastructure. We discussed how can we find recommendations that actually help in breaking the poverty cycle, maybe like job creation. Another thing that was recommended in grouping the recommendation in 2 parts. One part that can be implemented at the short term, and the second part that which can be implemented on the long term. Actually, Dr. Meg Rothman joined us yesterday as well, and he gave us this recommendation. In the presentation, by the end of the presentation, we'll give some suggestions about other recommendations that would like very much to get your feedback about these. Maybe whether they are feasible to be implemented, whether they should be on the short term or long term, whether we need to focus more on certain aspects, and so on. This will be discussed by the end of this presentation. Let me first start the presentation. Today, actually, we're discussing the impact of Russia-Ukraine crisis on vulnerable families and children in Egypt. Unfortunately, in the last decade, Egypt, this is the introduction for, this is the outline for the paper. We won't go through every item of this, but in details, but we're gonna cover them all briefly. Unfortunately, over the last decade, Egypt has been experiencing a success of shocks that started with 2011. Just after a short 4 or 5 years of instability, we faced another shock with when the central bank announced the liberalization of the exchange rate, which actually led to a decline with about 50% of the Egyptian pound value. And then just where we're trying to recover from this, the world, actually not only Egypt, was hit by the COVID-19, which affected not only the Egyptian economy, but also the world economy. Again, while we're started to recover from the impact of COVID-19 and the consequences of COVID-19, the whole world was hit again by the Russia-Ukrainian crisis that happened in 2020. And the thing is, it affects the trade exchange, it raised the inflation rates, and also the main thing, it was a main importer of wheat and other products for many of the developing countries, including Egypt. Just after like 9 months later, or even less, the Egyptian economy faced another shock with the devaluation of the Egyptian pound again in November last month, which again, it lost a certain value of a certain percentage of its value. Why do we care about Russia-Ukrainian crisis? Actually, Egypt has a long, strong relation with both countries. One of the most important things that we import wheat from these countries. Egypt sourced 80% of its wheat imports from Ukraine and Russia just before the crisis. Another dimension is the tourism. Actually, 30% of the tourists in Egypt used to be from Russia and Ukraine. And we know that tourism is a very important sector in Egypt. Another thing is the FDI. One of the most important destinations for Russia's FDI in coal, oil, and gas is Egypt. And Egypt relies on Russia for about 30 to 60% of its FDI in energy. This is the reason, actually, all these matters for the Egyptian economy. Let me briefly give you an idea how the wheat import was affected. Just before in the right figure, just before the crisis in 2021, we relied heavily on Russia and Ukraine in importing wheat. Just after the crisis, the Ukrainian share of imported wheat declined. The good thing actually is that Egypt started to look for other sources to import wheat from, as you see from the figure. Again, why the Russia-Ukrainian war crisis matters. Unfortunately, it causes high inflation rates. And according to the World Bank estimates, as previously mentioned, for every 1 point increase in food prices, 10 million people fall into extreme poverty. Some of them are children. The Russia-Ukrainian crisis had different impact on different countries, definitely depending on their vulnerability, the country vulnerability, and the dependence on imported food and other commodities. It's expected that the inflation and the increase of food prices will more likely affect developing countries such as Egypt, especially that rely heavily on the imported wheat from Russia and Ukraine. It was mentioned before that there was a simulation model applied. In conclusion, actually, given this model, it's expected that the head count poverty rate in Egypt increased by 1.8%. So before I go into this slide, let me explain something here. And the thing is, what we try here in studying the impact of Russia-Ukrainian war on the vulnerable households in Egypt, we don't have actually recent data. Till now, we don't have new hikes that we can see the impact of the war or the impact of the rise in the inflation rates. And we don't have enough data about other vulnerable groups, which are the refugees in Egypt. So what we can do is looking at the previous and the past scenarios that happened before and try to identify the vulnerable groups in Egypt and see the state that they are in right now and the risk that they're having right now, and that may increase even if the inflation rate keeps increasing. So this briefly, what this graph briefly tells us, in 2017, with the devaluation, the CPI jumped actually like 20 percentage points. And with this increase, the poverty rate increased by 5 percentage points. But afterward, when there was a little bit of stability And with the initiation of the Takaful and Karama program, the poverty rate started to decline again. So this is an alarming signal about the rise of the inflation rate. These figures, actually, I won't go through them, but it shows the inflation rate in the last year. And as you see, there was a peak just after the crisis. And it may increase again right now and in the future. It's not only about the inflation rate, but it's also about the food inflation rates. Why it matters? Because the increase in the food prices will affect the vulnerable, the poor households, especially those who have children, the refugees in Egypt that are not documented or even documented but don't have enough resources. So it's gonna affect them if it keeps increasing, and it's how it's gonna affect them. With the change or with the increase in the food inflation rate, it's expected the food consumption pattern will change. People may substitute their healthy food items with cheaper, unhealthy food items. They may reduce their food meals. So this will affect the households, affect the children, especially in their nutrition, which will increase the risk of food insecurity. This is another figure that shows the inflation rates for certain food groups. And as you see, it's very high, especially among bread and cereal. Okay, right now I'll give the floor to my colleague Nisma. We'll go briefly through the impact of on food security among the vulnerable household, poor household with children, the Egyptian one and the refugees.
Hello, good morning. I will go through the presentation. As we talked yesterday, the impact on the children. We will find that in this slide that the majority of poor households have children. And here in this slide, we can see that the food consumption pattern may change because due to the increasing of inflation rate, and this may affect on malnutrition, or this may affect the children nutrition. Because as Dr. Mai said, they may change their healthy food with, replace their healthy food with another unhealthy food. Here we show that the average per capita expenditure with constant prices by selecting some food groups. And here as another vulnerable group, which are migrants, refugees, and asylum seekers, Egypt plays an important role as a post-destination country and the transit country for migrants and refugees due to its geographical location. These refugees coming from other parts of Africa and MENA region. And over the last 10 years, there is a political stability in the region, such as in Sudan, Syria, Yemen, and this may lead to increase the number of refugees in Egypt. Also in October 2022, the United Nations reported that the number of registered refugees and asylum seekers in Egypt is 300,000, about 300,000 migrant refugees. Almost of them, half of them are from Syria, and more than 28% are from North and South Sudan. And the children constitute around to 37% of the refugees and asylum seekers in Egypt. Regarding the last point, we kindly note that the most recent estimate for documented and undocumented migrants is around 9 million migrants. The source is IOM 2022. This slide shows that how the vulnerability of refugees and how the inflation rate or the high inflation rate may increase their risk and vulnerable. In this slide, we shows that the government response. The government banned export of basic food commodities such as wheat, flour, oil, and corn for 3 months. Egypt also started negotiation with other countries to import wheat from France, Portugal, and India. The government has decided to expand the existing Takaful and the Karama program to cover an additional 500,000 households. The social protection programs such as Takaful and Karama and ration cards are still protective factors for poor households and poor children. This slide shows the coverage of Takaful and Karama programs in 2019 and 2017. And here we concluded that the government has a role to play in targeting those extremely poor households more effectively, and support the extreme poor and extremely poor and poor households. But still 74% of extremely poor households who have children didn't receive support from Takaful and Karama in 2019. This slide shows also the coverage of ration cards. Here, the policy recommendations. These policy recommendations that we suggested, and you feel free to suggest a new recommendation if you have related to the topic, of course. And we need to divide it to short-term and long-term policy recommendations. I will go through it in details. Build a more resilient agri-food system in Egypt. First one, reduce the country's dependence on strategic food imports, and by increasing agricultural wheat production, diversify the import sources, promoting the reduction of high bread consumption and bread waste. On average, Egyptians consume twice as much wheat as world average. And shift wheat consumption to wider range of food groups, and encourage consumption of locally available nutrition food as substitutes for wheat. Encourage households to diversify their diet towards healthier and more equitable diets. The second part will be support the most vulnerable groups, facilitate the issuance of required documents, and identify papers for identity paper for Egyptian and unregistered migrants in Egypt. Review legal and administrative barriers to accessing social protection for people in informal economy and migrants, refugees. Expand the existing Takaful and Karama program for social protection to cover more households, especially those who were unable to obtain the required documents. Reprioritize or reallocate public expenditure for those poor households through earmarked taxation or emergency donor funds. Collaborate and coordinate with international organizations to extend the social protection programs to migrants also, documented and undocumented. Increasing the monetary value of transfer provided through already existing cash transfer program. The increase should be equivalent with increase of the consumption increase in consumption and production cost inflation rates. Revise the school meal program to increase its efficiency and utility. Strengthening the resilience of social assistance recipients through stronger linkage between social welfare services and labor intervention. For example, immediate scale up for the forced economic inclusion program should be explored. Evaluate the process of transition from food subsidies to social safety nets, conditional cash transfer programs. And finally, the data, we need to have more availability we need to have more data availability under supervision. For example, Minister of Planning and Minister of Social Solidarity, especially for children weight and height measures. Thank you.
Thank you very much. Thank you, Dr. May. Thank you, Dr. Nesma. Peter, is there something that you'd like? I promised you yesterday. Is there something that you'd like to bring in from the discussion yesterday?
Thanks. Hi, everyone. I'm Peter Ragno, Chief of Social Policy, UNICEF. So thanks again. It's good to be here with ERF, the first step of this partnership, and there's going to be, we've already been discussing on how to expand, including next year, focusing on the inclusive social protection and how the government can consider including non-Egyptians. I also, before I give a couple of points, I want to thank my team, Lina, Francisca, and Omar, but also Sammam, regional advisor from UNICEF, that's going to be moderating the next session. Maybe just a few points. Yesterday's discussion was really candid, frank, and vibrant. I think that's how I would summarize. There was a very strong call to call this crisis a nutrition crisis. It's really about the access of the most vulnerable families, but not only the most vulnerable, also the families which are middle class, low middle class, to food. And it was really about caloric, we talked about dietary diversity. Now, and that's what probably the focus should be right now, focusing on the immediate measures that the government will need to take to mitigate the impact of this crisis. We also had some discussion about a longer term, and some of the policy recommendations are also here. We're talking about private sector, investing in education, skills, which obviously should be part of a broader poverty reduction and long-term strategy, but we need to focus on, we need to call this crisis for what this is, which is a nutrition crisis. We also heard yesterday a couple of figures by Professor Ebeliti as part of an analysis that WFP and UNICEF are doing on estimating the impact of the crisis on several indicators, and it are pretty different. These estimations are much different actually from what IFPRI is suggesting. So we are talking here, the magnitude of this crisis is going to be much more than what we saw in 16-17 when we had a 5% point increase in poverty. So that's a nutrition crisis, and the magnitude, it's really big. And I think everybody know that people are suffering, but soon we will know how much people are suffering. And it's the numbers we've seen are very worrying. And then maybe just a final point. Soon, we were talking about yesterday and also today about lack of data. It is true, the latest poverty data we have are 2019, so pre-COVID. The new hikes has just been completed, I think, a month ago, and we will have some results. The government will issue some results next year. And we may be able to capture a glimpse on the impacts of this crisis through these data sets, because there is some modules on shocks and coping mechanism, and it was done, part of it was implemented this year. So we may have more realistic figures on what's really happening and not estimation. And that's it from my side. Over to you for the next session.
Thank you very much. I'd like to just remind us all of what my colleague and friend Yasmin Fahim was saying all along yesterday. Yasmin Fahim is the Research Programs Director. So she kept reminding us all the time that this is work in progress. And what we're trying to do with this event that's been brought together in record time, and I thank our colleagues Namatullah and Namis, Nabil, and Huda Azmi as well for putting in all the effort to make it happen. But the idea behind the event yesterday and today is really to hear from you. So our colleagues have set the scene. They've done the preliminary research work. They're trying to put on the table the key issues that we need to look into. And we're very keen to hear from you and take that on board. Without further ado, I'd like to I'll just introduce our next session chairman and moderator, who's got a very distinguished panel that he'll be introducing and working with for the next hour almost to get the input. Mr. Saman Thapa, regional advisor on social policy and social protection, UNICEF. He is the regional advisor for social policy at UNICEF MENA regional office. In this function, which he assumed in July 2019, he's responsible for the technical leadership of the UNICEF social policy agenda, including social protection, covering 20 countries in the Middle East. So you're as regional as we are. That's absolutely great. In the Middle East and North Africa, previously he was chief of the social policy and child rights monitoring at UNICEF, Myanmar. And what else do you want me to highlight? It's quite an impressive track record. Where he led efforts to roll out the Myanmar's first ever national cash transfer for pregnant women and children, as well as public financial management capacity strengthening of social sector ministries. Prior to that, he worked with UNICEF regional offices in MENA and EAP, as well as CEOs in Vietnam and Cambodia, focusing on social protection, public finance, social accountability, and real-time monitoring. And National of Nepal. He's also got his postgraduate work in international development. Thank you very much for joining us today. The floor is yours.
Thank you. Thank you, Dr. Shireen, for that very kind introduction. Good morning, colleagues. It's an honor to facilitate this panel discussion. And maybe let me start with a little bit of context. You know, in a previous life, I was working with UNICEF in Asia Pacific in 2008, 2009. When we, of course, had the global financial crisis, which turned into a global economic crisis. And a number of countries in Asia Pacific at that point were trying to understand what lessons they could take from the 1992 Asian financial crisis to ensure that social indicators and basically families and children are protected. And one of the key takeaways when we were looking at the analysis from the 92 financial crisis was that social indicators take time to show. Right, so it's not like the financial markets or the real economy where GDP growth or certain indicators in terms of the financial markets show immediately, and countries and enact policy responses. What we observed is that indicators in terms of stunting, attendance, and completion rates in schooling, dropout took 4 or 5 years to show, because that's when you have actually the spacing between household surveys. So actually countries at that point in Southeast Asia in particular, such as Thailand, Indonesia, and Cambodia, took very active measures, learning from the 92 crisis to better monitor, understand, generate evidence on what was happening in 2008, 2009. And you will remember that that was also a crisis that was precipitated by rise in food and fuel prices initially, before it became a full-blown economic crisis. And in fact, because of these policy responses, families and children were better protected in that crisis compared to 1992. Now, why is this important in the context of Egypt today? What I wanted to say is I wanted to first applaud the effort being taken by the ERF and UNICEF in Egypt to commence this discussion on monitoring and generating evidence on the potential impact of the current multiplicity of crises, and in this panel discussion, which we're going to do now, to think about what policy recommendations should be considered and enacted on time to protect families and children. And to do that, as Dr. Shireen said, we have a very distinguished panel of 4 speakers who will share their perspectives with us. And then, of course, we would like to hear from you and also colleagues who are online in terms of what we want to suggest in terms of the paper that Dr. May and Dr. Nesma presented earlier. So briefly, by the way of introduction, we have Dr. Tariq Tawfiq, who is the Deputy Minister of Health and Population, and we are very honored to have you here, sir, this morning. We also have Dr. Mervat Sabrin, who is Assistant to the Minister of Social Solidarity and Social Protection. Dr. Mervat, good to see you again. She has 15 years of experience in the field of international cooperation and development, particularly on social policies and evaluation. And prior to her work with the Ministry of Social Solidarity, she also worked with agencies such as the ILO and UNICEF. So a very rich background in terms of giving us perspectives on social policy and social protection responses. We also have with us Mr. Scott Stanley, who is the economist with the UN Resident Coordinator's Office in Egypt. He was previously economist with the UN in Bhutan and the Regional Economic Advisor for UNDP in Asia Pacific. And prior to that, also with the IMF and the Center for Global Development in Washington, DC. We also have with us Dr. Iman Helmi, who is a senior economist at the World Bank's Poverty and Equity Global Practice, who is a microeconomist and development practitioner with over 10 years of work experience in the MENA region. Currently, she's a senior economist at the World Bank's Poverty and Global Equity Global Practice. And before joining the World Bank, she was Associate Minister for Social Solidarity, for Economic Affairs and Financial Inclusion. So without further ado, I will have a bunch of questions for each of our panelists to hear from them. And then we will have an open discussion with colleagues in the room and also online in terms of the feedback we want to give to the authors of the paper. So Dr. Tarek, I will first start with you. As we heard also from Peter, this is very much a nutrition crisis because of the rise we see in food prices, some very worrying trends that the paper has highlighted, that Dr. May and Dr. Nesma spoke about. We've seen, particularly an increase in inflation for food, and especially bread and cereals, more so in rural areas than urban areas. And we've also seen from a phone survey that CAPMAS conducted that households are adopting negative coping strategies in response to this shock in terms of food consumption, in terms of, food consumption and dietary diversity, as Peter also highlighted. So, Dr. Tawfiq, if you please could give us a sense from your perspective in terms of this nutrition crisis, what do you feel are the key implications of this crisis for households in Egypt from a nutrition, food security perspective, and particularly what you feel are important policy responses being considered by the Ministry of Health and Population in response? The floor is yours.
Sabah al-Khair. I would like to thank you, the forum and the UNICEF for this kind invitation. It's really interesting. I went through the agenda. I think it's full of very scientific and policy direction, which I think would be beneficial for the next maybe a few years. Well, from the medical perspective, from the health perspective, it's not just the nutritional crisis or the food insecurity. I think it's beyond this. It's beyond the pattern of nutrition will be changed. That the pattern of the burden of the nutritional disease will be changed. And we are going to have more than more just stunting or wasting. I think it will be beyond this. In addition, one of the other dimension is education. I think there's some kind of very good relationship between nutritional deficiencies and the educational attainment, which I think is very important. So we have the poor and the non-educated person, and this is, I think, a very bad repercussion in the future. In addition to that, the quality of food and the type of food consumed by any population in the face of this crisis will be changed. The nutritional value of their diet will be changed. And I think there will be some kind of many nutritional deficiencies will be emerged. And it needs special interventions. One of the issues which is important, I think you have to think about it, is the irreversible damage of some kind of CNS or central nervous system in facing this kind of nutritional deficiency like zinc and selenium. In the presence of anemia, it will be accelerated and will lead to cognitive disability. So it's not just merely the change in the pattern or the dietary behavior of the population. It will have a very grave consequences. So intervention is needed. Sure. In this regard, I think the Ministry of Health has some kind of a strategy which is not yet launched, but we have prepared it in the conjunction with the WHO and through the guidelines provided by the WHO to intervene on each and every segment of the Egyptian population, with very specific interventions even before the Ukraine war. And what kind of issue? Another issue is the initiative, the health initiative for the early screening. I think there will be some kind of initiative for early screening of malnutrition among the Egyptian children, which will soon be operated. I would like to invite the agriculture, the Ministry of Agriculture, because I think this problem need the collaboration and coordination of many partners to provide some kind of policy directions, which are necessarily for the near future, because we are not away from other disasters. I think we are going to have many. So preparedness is necessity now. So I believe this forum come up with some kind of practical recommendation. What should we do in the Ministry of Health and other ministries to avert this kind of consequences? What intervention we are going to need, especially geographically, because poverty is not it's not random, and it has very clear demographic and geographic boundaries. Is it enough for the social safety net? Will it be the solution? Food subsidy will be the solution? We don't know. I think this is a function of the forum today, come up with this kind of intervention. Which is which? And thank you very much. Thank you.
Thank you, Dr. Tawfiq, for that very concise but impactful intervention, I must say. I think you've highlighted some key issues there. The first is the fact that short-term coping strategies due to the crisis today might have permanent and, as you said, irreversible impact on children, not just physically, but also cognitively. And I think this is an imperative for why the policy responses need to be timely and need to be comprehensive. As you said. The second thing I heard from you is the need for multi-sectoral responses. Yes, this is a nutrition crisis, but it goes beyond that. There are also impacts in areas such as education, in terms of requiring interventions from the agriculture side. So I think what you're calling for is timely and multi-sectoral responses and preparedness to address poverty and food poverty as well, which is what we were talking about here, which requires us to, of course, pay attention to social assistance, to food subsidies, but also creatively think about other policy mechanisms needed. So thank you very much for that. So our second speaker, and I'm delighted to invite Dr. Mervat Sabrin, the Assistant Minister for Protection and Social Safety Nets, to share her views. And Dr. Mervat, if you could please, highlight to us your reflections on a few things in particular. The first is, during the COVID-19 crisis, I think we saw a very significant scale up of social protection in Egypt, one of the largest, I think, in the region. So given that the impact of this crisis is expected to be even more significant than COVID from a socioeconomic perspective, we wanted to hear from you whether similar measures are being planned by the Ministry of Social Solidarity to protect vulnerable households, and if there are particularly any specific measures taken for families with children, because the paper also highlights that while Takaful Karama itself has seen a very significant increase in the last few years, there are still some important gaps in coverage for families, poor families with children. So we just wanted to hear from you about what policy measures are being considered by MOS to strengthen the resilience of the population, but also to lay the ground for wider socioeconomic development. Thank you, and over to you.
Thank you, Simon. Thank you, ERF and UNICEF for this generous invitation. This is a pleasure for me to be with you today. Unfortunately, I couldn't join to you yesterday. I will preview quickly about the measurement adopted by the government starting from April 2022. The government announced about a big social protection package to mitigate the negative impact of Ukraine crisis. First of all, the government increased the salary for the self-servant governed by the self-servant law by 50%. Also, if for the people who are not addressed by self-servant law by 15. Is a self-servant 8% from salary, and self-servant employees increased by 15. And this cost the treasury 36 billion. Also, Ministry of Social Solidarity added 450,000 households to Takaful Karama, and this cost around 2.7 billion. And we increase the minimum wage from 2,700 to 3,000. Also, Ministry of Finance announced about increased exceptional bonus for state employees by £300. In July, the Prime Minister announced about another social protection package. Mainly, we added around 1 million household family to Takaful Karama. This is meaning will reach by 2023 to 5 million and increase the cash transfer budget from 19 in 2021 to 25 billion in the budget of 2023. And the cost of the 1 million household added to Takaful Karama will be shared between the government and social society. Okay. Also, Ministry of Supply and Internal Trade announced about 100 monthly in-kind subsidy. This is will be informed ration commodity determined by the Ministry of Internal Supply and Internal Trade. Also, we increase the limit exemption, tax exemption from 24,000 to 330,000. This costs the government around 67 billion, this package. This package is starting applied from April 2020 and will continue until June 2023. Also, we increase the pension by 13% starting from April instead of July, 1st of July as usual, and also the increase of wages starting disbursement from April 22 instead of July. And this costs the government a lot of money because we talk about increasing the wage bill as not planning as the government tries to review the social expenditure, especially decreasing the wage bill. So this is the benefit package, the package announced by the government. If we talk about comparing with what the benefit package or the social protection package announced from the government during Corona crisis, this is cost around 130 billion Egyptian pounds. Now we look for the new hikes. The survey of income and expenditure survey, hopefully Dr. Heba Lisi, I think they going on to finalize this survey to measurement the impact of coronavirus on the poverty line, plus also the Ukraine crisis. This will be very, very important. And this leads us to some measurement need to be adopted from the government to comprehensive social protection system here in Egypt. First of all, we need to establish a database about the social protection intervention from the government, also from the civil society. And you remember, Simon, when we in Lebanon discussed the monitoring of social spending in Arab region or in MENA region, we talk about the Arab countries have a good behavior or manner in social protection spending compared with the housing, with food subsidy. This is first. Also, we need to establish a comprehensive database about the intervention from the government, from social society, from the donors themselves. This is the first one. The second one, we need to assessment the social protection system here in Egypt, because we have a lot of gaps in this system, especially for irregular worker, for migrant, for refugees. And Corona shows this problem, the informality. Egypt suffering a lot from informality, and Ukraine crisis show the dilemma or the problem of food security. And this was an incentive to the government to review all the programs and social protection umbrella to find out the gaps. So we have a gaps in maternity, we have a gaps in work injury, for employment. This is for informal sector and also for migrant workers. After that, we need to robotize the social spending according to the critical areas. We need to work on integrated and holistic system to integrate and the coordination between social assistance programs and social insurance, because we're facing in Ministry of Social Solidarity people opting out from social insurance to go to and get the cash transfer assistance. And this is had a very bad impact on the sustainability of social insurance system and health insurance system. Also, we need to automate all the social protection service. This will make easy and provide access and secure access for people for social protection. And the most important thing, the awareness and the awareness and the awareness. We reforming the social protection system here in Egypt starting from 2015. We reforming the pension system, we reforming the healthcare system, but people don't know anything about the benefit introduced by social protection system. We need to work on the awareness. And the last thing, we could do anything without resources. I mean, we have a limited resources, so we need to review the social spending, and we did it with in collaboration with World Bank to find out what is the area needed from the government to direct the spending with efficiently and effective method. Thank you.
Thank you. Thank you very much, Dr. Mervat, including for bringing that very critical angle on social spending. So what you've highlighted is definitely the significance of the socioeconomic measures that the government of Egypt has, enacted in response to the current crisis, which I think indicates the level of the severity, of the crisis that the government views. But what I heard from you is particularly three key areas in which, policy and programmatic responses are needed to ensure that the responses, are commensurate with the impact that we're expecting. You highlighted the need for stronger evidence in terms of understanding the spectrum of social protection interventions and, the systems. How strong are the systems and short responsive are they? How much of their integration is there between systems? You've highlighted very crucially at the level of households the importance of awareness, and you could say this is about managing and communicating the reforms. because you might institute measures, but households might not be aware and the uptake might not be there. And the third area, I think, which you highlighted, which is quite crucial, which leads us very nicely into the next intervention, is the need to look at social spending holistically so that responses in one social sector are not seen as a threat to responses in another social sector, and also paying attention to the efficiency of spending, as we discussed at the launch of the SEM report. Thank you very much. So our third speaker, Scott, we have a few questions for you in terms of your perspectives. The first, flowing from this point on financing is, do you think there are any innovative financing mechanisms that could be considered to ensure, continued funding for social sectors to protect the most vulnerable from the impacts of the crisis? And I might add that, perhaps this in a way that is seen as a complement, not a supplement to public finances, which is also where the investments are needed. And secondly, we have been talking about inclusive policy responses. So if you could also, share your thoughts on how the crisis is affecting Egyptians, but also migrants, refugees, and asylum seekers, and what type of policy interventions might be needed to ease impacts on those segments of the population. Over to you.
Thank you very much. Thank you to the chair. And also let me also thank UNICEF and ERF for the invitation to speak. It's definitely an honor. If I may, I wanted to make two kind of broader contextual points before I get to your questions, but I promise I will get to those questions also. The first is a reflection I had on the discussion yesterday, and also some of the recommendations that were presented to us already this morning. I was lucky enough to attend, as Peter said, a very candid discussion yesterday. So I just wanted to reflect on one thing. And then the second is to kind of position, I think, the UN systems work overall in this area. This is something that Jeremy mentioned in his opening. So the first is on this idea about building the evidence base in order to implement, or in order to inform policy, move to implementation. So, and I think that is very much the purpose of this exercise. It's very much an area where the UN has been focusing, I think, not only in response to this crisis, but just generally. But as we push a little bit on this idea, especially on data, the need for improved data, I think it would be quite important for this work to emerge or to bring out very specifically what we mean by that and how to do it. Because I think if I reflect on my own experience in task force, different workshops, etc., I think that the need for improved data is there universally, almost every time. And this is not without reason, but it also is because I think defining when you have enough evidence is kind of an elusive concept. And so I also appreciated, I think in this context, Dr. Mervat's specific examples of the type of data that would be most useful. And I was reflecting on yesterday. Okay. That one clear thing that jumps out to me would be building as a standard practice. I'm getting a new one. Hello, thanks. Almost standard operating procedure, the strengthening of the M&E system for all the interventions. I think I was struck in particular by the work from JPAL yesterday, talking about including whenever there's a new intervention, a cash transfer, for example, making sure to have systematic baselines, follow-up assessments over time, because that's the only way to build the real evidence base on impact. And I think that as a recommendation going forward, to build that evidence base within Egypt specifically would be quite strong. So that's one thing. The second thing is on the lack of good data. I find sometimes to be, I'm guilty of this. I think a lot of people most likely are. I don't want to speak for other people, but there's a bit of a paralysis that can come when you don't have the data. So I think that avoiding that paralysis and still acting even without perfect data is also really important. And I think this speaks to what Peter said at the beginning, that this is in a crisis moment, you might not have, it's not a perfect situation. And there's still a need to act and to serve vulnerable populations, especially in crisis, even while you're in parallel building up these more effective systems for data. And I think that that's another point I wanted to make. So in this case, you might have to go with a second best solution, for example, or look at global evidence. Also, as we heard from yesterday, global evidence of how it's worked in other countries. It's not ideal, but it doesn't mean that you can wait around before all the data is collected. So that's one thing. The second is, gosh, these things don't like me. The second thing is looking at the UN's this SDG fund that Jeremy mentioned in the opening. I think it's quite important to think about how the UN system overall is approaching this, because it's beyond this very important exercise on policy dialogue, building evidence overall, hoping to link to action, as I said before. Is also thinking about that bridge between the short-term response and the long-term, so that this window of funding, as Jeremy said, is about making sure that the crisis doesn't direct countries away from achieving the SDGs, and very specifically in response. And I think in those two main ways, one on building evidence base, but then that can be leveraged into later support. And then a second one, coming with short-term interventions now, but with a longer-term view about building the resilience of the overall system for future shocks. And I wanted to just point out the other work that's going on. In addition to UNICEF's work here on the policy dialogue, UNICEF is also working on working with the Ministry of Finance on transparency of the government responses. And I think that communication with the public is quite important, especially in a crisis, but also beyond. That's one thing. WFP working on food security and doing some analysis on availability of commodities, simulations on potential price impacts going forward. And then IOM is looking at specifically on migrants. So looking at analysis of needs, coping mechanisms, et cetera, again, as a first step in order to inform future policy. So I think that I just wanted to point out that it's an approach that is touching on all of these different areas. Now on the two questions. So I think on the first, on financing, I think my answer might not speak exactly to what you were referring to, because I do think that it is quite important to focus on maybe the non-innovative space, especially on social protection and social services, because I do think that in the long run, public finance is the key, and without the public finance, domestic public finance, you won't have sustainable systems for social protection. I think that the role of development partners, including the UN, for example, is quite important. As I said, we have an emergency window that this work which is supporting this work, but that is primarily, I think, as a transition financing, co-financing, in order to help build up the system eventually for transferring to the long-term support of the government. On that long-term support, maybe building the fiscal space, as also has been referred to before, that there is existing fiscal space, but I think in parallel to the reviewing the efficiency of spending, maybe the coherence of different spending across the different programs within the social sector. You also have been trying to increase the fiscal space, which really is about domestic revenue mobilization. So it's a bit more traditional, but actually there is a lot of gains to be had from that. So if you think about tax administration reforms, I think the IMF had estimated before the crisis, I think about a 2 percentage point increase in GDP, tax revenue over GDP from the reforms that had been launched, which is actually quite a lot of money. And if you think about tax exemptions, tax holidays, tax evasion, et cetera, that's quite important. We've also already touched on the reprioritizing expenditure and those types of reviews, but also looking at taxes and kind of earmarking funds from taxes specifically for the social sector, just as different ways of thinking about this overall increasing the envelope. That is a bit in the long term, and I'm also conscious, I think, of our discussion about specifically what might help now. And one area I think for increasing that allocation maybe to these critical needs is this analysis of the cost and benefit. including over the long term. I know that this is something that UNICEF is quite active in. I think when I was in Asia, I know that there's a social protection costing tool that does different simulations about how if you change the level of benefit, what that means for overall cost of the mechanism, but then also the potential benefits. I think that this is the kind of thing that is actually quite powerful when making the proposals for different interventions. So it's different costing scenarios, different simulations, ideally with benefits tied to it. And in essence, it's the investment case. But I think that when you think about new interventions without that very specific costing, it's a more difficult case to make, I think, for the policymakers. And I think that having the options is also can be quite effective. That's one thing. I think the second is on the looking forward and the resilience of the system. I do think that this kind of contingency planning as a focus area is quite important. So if you think about understanding what the potential costs of expansion of your cash transfer system would be in advance, and to have that contingency financing already set up so that it can be deployed very quickly, I think has been quite effective in a lot of countries. So if you think about something where if your cash transfer is tied directly to an automatic trigger on food prices or something like that, so then you know that this is just an example, so that if food prices go over a certain threshold, that you'll increase your transfer by a certain amount. You can already have that costed, and you can build this automatic trigger that then would make a quicker response, and also to have the financing ready for it. I think that would be a good suggestion. Then my last point. Oh yes, of course, on the vulnerable groups. This is very much a focus of, I think, the UN's work overall, and specifically within this, what we are calling the development emergency modality. I think it's important to take a step back and think about, or to understand why this focus, I think, on these specific groups. Again, I think here we do have a gap in the data and the understanding specifically of the impacts on migrants and refugees. This is actually one of the activities that is going on simultaneously with this exercise, is to build that evidence base. So I think that speaks to your question. But I also, again, back to my original point, it doesn't mean that we don't move in parallel, I think, for support in the short term, because I think the evidence that we already have on the impacts of shocks on migrants and refugees is already quite striking, quite strong. I mean, I think there was a UN system analysis of the impact of COVID specifically on these populations, which showed an outsized impact, let's say, on both of these populations. And I think that even in the best of times, I think that we know that there are challenges related to access to finance, access to livelihoods, social services, et cetera. And I would say in the short, so looking then at the responses as we develop this evidence base, I break it into the short term and the long term. And colleagues in the paper have already outlined, I think, very specific recommendations, which are quite useful on, and so I won't repeat that, but just to say on the short term that there is direct kind of topping off or cash transfer assistance coming from UN agencies, specifically in the context of the crisis. So this would be WFP, UNHCR, IOM. And then in the long term, I would point to three things. I think the first is this idea about ensuring the longer term access to the standard government services. So I think this was touched on by colleagues earlier, but quite important, about access for migrants and refugees to education, social protection, health, et cetera, and just ensuring that not only that the access is there, but that the communication is there, and that the knowledge and the awareness of what is available is made clear. I think the second is one of the areas where the UN is working is the bridge, again, the bridge between the short and the long term. So it's not just about the cash, the immediate cash transfer, but it's more of a comprehensive package of services. So this would be about speaking towards livelihoods training, financial inclusion, et cetera. And then finally, since I started on data, I'll end with data also. I think that more systematic data collection of migrant and refugee populations, which is one of the recommendations in our opening presentation that I would flag that as a high priority. And I'll stop there. Thanks.
Thank you very much. Thank you very much, Scott, for those very, very interesting and helpful reflections. I think, on your reflections from yesterday, you're almost saying, don't let the perfect be the enemy of the good, right? In summary, in terms of thinking through these responses, because, there's never a perfect amount of data to make a policy decision. What is the appropriate and good enough amount of information needed to make decisions, which we need to focus on, and the UN having a very crucial role in helping provide some information in that respect, through this development emergency modality, actions already being taken by UN agencies in that regard. With regards to the specific questions you highlighted, actually, very importantly, I think, the criticality of tax-based financing to expand and implement social policies and social protection to make it sustainable at the end of the day. That's what it is. While innovative financing can be a complement, a catalyst in some ways, and perhaps be a bridge, as you said, the core of social sector responses need to be through tax-based financing. And you also highlighted the very important issue about expanding fiscal space, but also improving efficiency and spending within existing fiscal space, which was also at the heart of the discussion we had on the social expenditure monitor a few weeks ago. And on your point with regards to vulnerable groups, I just wanted to highlight this call for, even in normal times, to have better data on refugees and migrants. But also not to only wait for that perfect amount of data again to come through, but to find responses that bridge the short term and long term, and that consider migrants and refugees and asylum seekers as part of responses provided by the government in terms of social services and social protection. Maybe that's a question about how we can systematically commence this discussion. I know that, Peter, this is something that we have already been working on, and the UN can play a very key role in that regard. So thank you again. So I will turn to our last speaker, Dr. Iman Helmi. And Dr. Iman, in your reflection, if you can please, given that the World Bank is a very key player in providing assistance to the social protection system in Egypt, if you can describe what you think is the World Bank's view of the role of Egypt's social protection system in the face of the crisis, and particularly whether you think if the system is shock responsive enough. We've seen the response to COVID. We are looking, as Dr. Mervat said, to responses now. So, but also to understand your expert views in terms of how this can be improved further, building on the gains that we have, and basically how this can help address the impacts of the crisis on poverty levels. So, thank you, and the floor is yours.
So good morning. I'm very pleased to be in this panel discussion, and I'm really thankful to ERF and UNICEF for the kind invitation. I think it's hard to talk about or to speak after this distinguished panelists, but I will try to build on what was already said and try also to reflect on the policy brief provided by Dr. May and Dr. Nisma. So if I may, before answering the question about policies and going to policy areas and social policies, if I may just make a point about transmission impacts or transmission channels and evidence, because I think it's important, and a lot of speakers yesterday and today raised the point about the data gaps. So first of all, I think we have to identify the impact channels before talking about the vulnerable groups like households with children or migrants, etc. I think it's important first to identify the different channels through which we can expect the impact of the crisis to be transmitted to households, because we have, as we see from the evidence provided by Dr. May, we all expect inflation prices to be affecting the poor in Egypt. Egypt is a large importer of food and wheat, and we see the consumption channel is the key channel in Egypt, especially for poor households. And if I just give you an example about the bread and grains, means it's around 15.5% of the budget share of total consumption of the poorest decile, compared to 11% for the richest or the upper decile. So as you can see, we expect this loss in purchasing power to be really affecting households in Egypt through this consumption channel. There is another channel maybe that was not highlighted strongly in the policy brief, which is the impact channel. Because for some households, if there are net buyers of the production of wheat, for example, in the market, and prices are increasing, there is another income channel that should be also maybe considered in the paper. And then talking about also the evidence provided by the World Bank, since the crisis started maybe in last February, we have been working closely with the Ministry of Planning and Economic Development and counterparts in the government in providing evidence and generating evidence related to the potential impact of the crisis. For example, we had cooperated with Basira also on generating 3 rounds of phone surveys. The World Bank had already started the phone surveys in COVID, and then we continued also some rounds to get the initial impact of the crisis. And as we can expect, we can see the change in the consumption and the negative coping mechanisms adopted by households. And the magnitude is even bigger compared to the COVID, which is again highlighting the different nature of the shock that we are facing now. It's different maybe from the COVID. It's more towards food crisis and nutrition crisis, as also highlighted by Dr. Torres, that could be having some impacts and cognitive impacts or the development impacts on children, especially that we have also that maybe in 2021, based on the Egypt Health Survey, anemia for children from 0 to 5 had already increased, reaching around 42%, which is still maybe after the COVID, but we still don't have data about even what's happening when households are changing their, not only they're limiting the quantity of food or the size of meals, but we have also seen evidence about the reduction in the diversity or the quality of food. And this is especially affecting households also with children. And of course, we are trying to complement our micro simulation at the bank with this real-time data, but also we have some simulations trying to project the impact of inflation using different scenarios about the devaluation and inflation, but this is still work in progress. So maybe in another occasion, we can have an in-depth discussion regarding that point. And finally, we are trying to monitor the CPI or the inflation for different groups, including poor and non-poor or middle class, because again, we expect or we have seen that the inflation at the beginning, like in April or May or June, it was highly for the poorest decile because it was mainly triggered by food. But then as we move on by time, we started to see some converging trends. It's becoming closer because if you remember in July, we have also faced an increase in the prices of transportation. So again, we can see that all households are being affected. Of course, the magnitude is different among poorest or most vulnerable households. But again, we have to monitor, I think inflation for different groups is very important to be identifying this through the different impact channels. So now I'm done with the theoretical part or maybe the evidence part, and let me move to the policy part. What I will try to do also is to talk about 3 different policy areas, and I'm sure that under each area we can have like 1 session dedicated to the discussion. But first of all, I think we need to talk about like expanding adaptive social protection. And the bank had been supporting the government of Egypt and MOS throughout the previous years in terms of Takaful and Karama program. And also we can see that the discussion is not only about the coverage, but the benefit. And I will talk about this point in few seconds. But first, I would like also to highlight that the paper might be talking more if there is a chance about the cash plus intervention. Because Takaful and Karama is not only about providing cash transfer to the household, and we have an independent impact evaluation run by IFRI and supported also by the World Bank, and we can see the different positive impact on the consumption of households who are getting cash transfer. However, it's also maybe important to talk about the different interventions that MOS had provided based on the social registry or the database that now MOS is having, not only the delivery system and the digital payments, but the social registry is a very important point. And building on this social registry that has many households, not only beneficiaries of Takaful and Karama, but also non-beneficiaries, I think the government of Egypt and MOS were able to have an adaptive social protection that could be expanded whenever there is a crisis. However, again, I don't want to ignore an important point whenever we are talking about expanding social protection, whether it's horizontal or vertical coverage or benefit level. I think it's very important to complement the idea by talking about physical space and physical sustainability. If we have unlimited resources, we can provide policymakers with a long list of measures. But since we have limited resources and limited financial resources, especially, I think it's very important also to highlight that point. And recently, also the World Bank had worked with the Ministry of Finance and with line ministries, including MOS, Ministry of Education and Health, on publishing the public expenditure review. It's a public report that I can share also with you if needed. And in that report also, we used the physical incidence analysis tool, which we have developed with the Ministry of Finance. And this tool is allowing you to compare between different policy measures on the physical side, trying to see the marginal contribution of each measure in terms of poverty reduction and inequality reduction. And I think it's very important here also because maybe the whole system, based on the results, we can see that social assistance programs in general in Egypt are triggering a reduction in poverty by around 6.5 percentage point, excluding, of course, spending on health and education. But when it comes to the comparison between detailed measures, I think there are also some good policy insights that we can provide. Because, for example, if we talk about food subsidies, we can see that it is having a positive impact on alleviating poverty, but it's coming at a higher cost and maybe lower effectiveness compared to cash transfer and other programs. So I think it's very also important to compare between the different policy measures. And when it comes to expansion versus increasing the benefit level, we have also worked on some like evidence to be provided or that were provided in this report. When we reach a certain point of expanding, after that point, expansion is not as cost effective as previous one. So maybe it's time to think about benefits. So based on this tool, we were able to identify like a certain point of coverage. And after that point, it might be more cost effective to increase the benefit level and not only the coverage. So this is the one, like the first point that I would like to make about the policy area. The second policy area is that improving the productivity of farm resilience and increasing the climate smart agriculture practices for poorer areas. Because also I think that the policy brief focused more on the immediate action or the immediate policy advices, but it's still, while thinking about the crisis and the immediate action, it's important to consider the medium term because the next crisis will be coming sooner than what we expect. And when it comes to resilience, I think it's also maybe important to talk about, as I mentioned, for example, reducing the waste of wheat supply chain. Look at the whole supply chain and try to identify different waste and what could be done, for example, in order to support the effort to reduce waste and loss, improve the domestic cereal production, strengthening the resilience to future shocks in terms of agriculture. And I think Dr. Tariq also mentioned the point about bringing in the Ministry of Agriculture in that discussion. And also the World Bank is supporting the government of Egypt through an emergency food security. And we are trying to look also at the silos and improving the capacity of the silos in that regard. My last policy area is related also to the job, because I don't want to forget the job agenda and the economic inclusion, increasing the productivity of micro enterprises, having access to finance. And I think Dr. Shahir also touched upon the same recommendation yesterday from a macro angle, but again, from the micro angle, we can still talk about the economic inclusion and its importance, the importance of having the private sector generating decent jobs in the terms of like investing and increasing the productivity. This is also an important area. So I think I stop here and yeah, we're looking forward to the rest of the discussion. Thank you.
Thank you, Dr. Iman. Thank you for your remarks. I think you highlighted very importantly, for the paper, the need to also consider very clearly the direct and indirect transmission channels, not just the consumption side, but also the income side, which I think is a very important point to consider. On the policy respect, I think, you highlighted the criticality of shock responsive social protection, not just in terms of the programs, but also the delivery tools, and particularly the information management system, paying attention to the fiscal aspect and sustainability of anything that is done in that regard. But also bringing in the angles from the policy side about resilience and climate smart interventions. Going back to what Dr. Tawfiq was saying, bringing in a multi-sector perspective in that, And of course, from the World Bank side, also reinforcing the importance of the jobs agenda, because it's not, as a part of a comprehensive response, it's not only about the social assistance, social protection measures, but also, strengthening livelihoods and incomes of families, when we face a crisis like this. So thank you to once again to all the distinguished panelists for the remarks. Dr. Shireen, I believe we have about 30 minutes for the open discussion, if that's okay with you.
Yes, we do. 25 minutes.
25 minutes. Okay, so the floor is open, colleagues, for anybody who has comments and questions. Also, anybody online that might want to, chime in or has any questions. So maybe we take a few questions and then, go back to the panelists for the sake of efficiency. So if you can also please introduce yourself.
Yeah. Hello. Okay. So I'm Ali Hafiz. I'm the head of nutrition in the World Food Program, Egypt Country Office. And thank you very much for a very interesting discussion. I might just have a few challenging points, but being a nutrition person, and since nutrition was the first word that was mentioned immediately after the interesting presentation, thank you very much for the very good presentation. A first general point that I would say that I think we need to have more specific recommendations in the coming period. Because if you mention nutrition, everybody was talking about educational attainment, but I would go back and look at child and infant mortality rates, which have actually risen as per the latest family health survey, which was mentioned by Jeremy. So it's not just the stunting and the wasting. We really need to look at the final impact on the individuals and the big impact on the country. And I think this is a neglected point. So it's very important that we have this. We've been mentioning stunting and wasting, but we're not mentioning non-communicable diseases, overweight and obesity, which are the second leading cause of death in Egypt. Again, related to mortality, there's a big burden on the health system that is coming up that is not being mentioned, quantified in relation to poverty and food insecurity. So I really think that when we talk about data and systems, data systems, information systems, Egypt has a very good opportunity to make use of the available data. Yes, we do need to work on strengthening data systems, but I think we need to look at the missed opportunity of using the existing data. So linking different systems is very important. And the Ministry of Health and Population advisor to the minister had mentioned that a multi-sectorality. If we talk about multi-sectorality, then it has to apply to systems as well, not just interventions, because how are we going to link interventions if we don't link systems? Ministry of Health has a well-defined system to a good extent, but again, they're not looking at the data in comparison to how impactful it is at the public health system. Dr. Iman had mentioned anemia. So, I mean, if we link the impacts, the intervention, the progress using this data, instead of looking at new data systems. HIKES has a well-established data system. It already has a wealth of data. So we can look at specific impacts to evaluate social protection programs that look at nutrition, like the first 1,000 days. The government has invested a lot. The UN is helping as WFP, of course, but we are not going to be there forever. But we can link the cost, the benefits of that intervention on the impacts of reducing child stunting, maternal mortality, infant mortality, and child mortality. So perhaps that's the kind of evidence that need to be generated to look at impacts at the short and longer term. But we can make use of the existing data. It's just that they need to be linked, and perhaps this is something that we can support at the technical level. Another thing also that I would like to mention is the food subsidy system. And I know it's a very sensitive issue and a topic. However, if we had done a study before on the impacts on malnutrition, actually, and that it is actually contributing to the double burden of malnutrition. So perhaps also this can be better informed people's choices. What are we availing to the population, and is it really to their benefit from the nutrition perspective? We keep mentioning wheat as a strategic opportunity. However, I also like the recommendation here on the alternatives to wheat. I know it was not very well pronounced, but I think honestly that it should be factored in because there are alternatives. The recommendations related to agriculture and productivity do bring that in perspective. Do we really need to rely on wheat? Can we move gradually to other alternatives that are healthier? Because we do have a problem in obesity, and wheat is a major contributor to that, especially that we spoke about the negative coping strategies of families to adopt unhealthier, less dietary diverse, more nutrient dense. However, they are empty calories. So, so these are more specific recommendations that I would really propose here to the table if we really want to focus on nutrition. I think an important also aspect is Egypt now is focusing on food systems as a whole. I think we saw that in a lot of the initiatives that are being adopted, especially I think also the climate change agenda perspective looks at that. And so if we look at the whole food supply chain and so on, the national nutrition strategy that was mentioned, without a governance system that governs how all this and prioritizes what are the key issues that we need to look at in terms of nutrition, which is very closely related and follows the same pattern as food insecurity and poverty, then I don't think we're going to go anywhere, because we did have a nutrition strategy earlier that was not operationalized. You can operationalize at the different levels. Social protection agenda is doing a great job. Health is doing a great job. But if we don't have a governance system that looks at what do we need to achieve in terms of impact on the population for nutrition in the coming 5 and 10 years, then I honestly don't think that this is going to be, going further. So I think I put in a lot of points, and I think I spoke about everything. So I hope I didn't confuse.
Thank you. Thank you very much, Alia. I think somebody also had a hand up on this side. And then side.
Is it working? Yes. So just, I wanted to link with the World Bank intervention and the impact, especially on, I'm Elena Ferrari from UNHCR, for the impact of certain costs, especially on refugee families. The one huge cost is transportation. This is due to the residency that is basically to be renewed every 6 months. Which implies that entire families have to travel to Cairo basically several times because it takes several appointments. And so I was also, I would suggest for the short term to look also at ways to lower the cost in line with the legal framework and the policies, but refugees are facing higher costs due to practices that are much more stringent and rigid. And this applies to the financial inclusion, informal sector, and especially the residency with the increased transportation costs. Thank you.
Thank you very much. Sarah.
Good morning, everyone. Thank you very much for the invitation, such informative roundtable, and thank you, UNICEF and ERF. This is Sarah Eid. I am the head of transparency and citizen engagement unit. I have 2 or 3 ideas just to share and maybe to raise questions how we can move forward. We heard that this is a crisis moment, and I would love to say it that crisis equal opportunity. This is how I was taught, and I'm not here only to talk on behalf of Ministry of Finance, which of course I would love to share some of also updated numbers, but also as someone who has been really involved in NGOs, because I understood during my 22 years of experience as a civil servant that the government cannot do everything alone. So first, I would love to speak about, to link also about what Iman just shared about the fiscal space, and sometimes it's not the only solution. We already have been, as the Ministry of Finance and the whole government, exerting lots of effort, and maybe this could be the ceiling of the fiscal space that we have, given, of course, the limited resources. We did have some stimulus packages at the beginning of the year, 130 billion Egyptian pounds in February, and then followed by another one, a smaller one, from 11 to 12 billion in July, and in August, and like just shared, Mirvat, maybe another 67 billion. And it wasn't only to expand the social safety net, but also to support all the segments, and especially the exporters, the manufacturing, how to alleviate, of course, the burden from different vulnerable families. And with all due respect, it's never enough. So if we only put our thoughts in the traditional way, this will help us miss the bigger opportunity. And which will take me to the second idea I would have to share, and one maybe of my recommendation, given that during the last 7 to 8 years, we have been engaging citizens. And when you involve citizens in the decision making, it's simply enough. You only don't address their needs in a very efficient way, but you also increase the satisfaction. And this is the thing that we need all to think as an economist is, we need definitely from the data. Of course, we are working on better data, by the way, with the UNICEF for more quality data from program-based budgeting to improve the budget for child, but also, and of course, transparency. We are increasing the briefs. We are the quality of data that we are and statistics that we are producing together, but transparency that is not used is useless. So we need to take all those data and try how to improve the people's life in a very practical way. And here I'm talking about using the untapped resources of 110 million citizens in Egypt, which 40% are under 18 years old. And if we add even more, like 65 or 70% under 35 or 36 years old. So we need those youth. We need to engage them. We need to, well, not only awareness, we need to, and this is the model that we have been trying to do lately in the Ministry of Finance, using the participatory budgeting, how we can take those citizens and take them, you know, to a different turnover, not only becoming a part of the problem, but a part of the solution. So those citizens being trained for the last 3 years, now they are helping the governor himself in reaching out for people for solutions. They have graduation projects, and they are now working diligently in also to monitor. You know, we have been spending on Hayat Karima more than 1 trillion Egyptian pounds. This is the biggest ever program for infrastructures and to improve people's life. More than 58 million will benefit from this amazing initiative, but they will also help us to monitor to which extent those projects were implemented and who have been really benefiting from Takaful and Karama. The third thing that I want to say that we need to not only have, of course, I am seconding the multi-sectoral emphasis, but also we have to work together. No one is excluded. It has to be all stakeholders. Everyone should be involved, because it's a time that we all need to think not only out of the box, but inside of the box. If there is any empty, like beautifully said by, I can't recall who, that we still have lots of existing opportunities using the same exact data that, no one, can only depend on the data of the hikes, but there are phenomena that are increasing in our society that doesn't even need anyone to have more data. So if we're talking, it's not only about the poverty, I'm talking here about the mindset. The poverty is not only the monetary poverty, it's the mindset. So in Fayoum, for example, and Alexandria, where I do go for the participatory budgeting and the public hearings, I can see the increasing, violence and harassments and abuse and marriage for children. And it's about the mentality of the parents. It doesn't, even if you give them more money, this will not change the problem. So we need to have more and broader vision together about the existing situation that we are all facing. I don't like to say again the word crisis because it doesn't help. It will be more like how to best utilize this situation to work together, and it's definitely the international organization. It's more of the private sector, the NGOs, everyone, the academia. We are all needed, and no one is excluded. And just to finish my thoughts, that whatever is happening right now, and definitely we never know what will happen later, it's can be overcome, and it's not only about nutrition, and it's not only about fiscal space and the government and who and the data. I know these are all very much needed, but it's about our willingness to go out of our comfort zone and do things that we will never that we don't always do it, you know. So we just need to step in.
Thank you very much, Sarah. So we have 1, 2, 3 questions from this side.
Okay, let me first thank all the panelists for the great ideas and the comments and the rich thoughts, and thank all the audience for their thoughts and comments, and the recommendations actually from the panelists as well. And I just want to talk about 2 things. First of all, the nutrition again. Unfortunately, it's gonna increase. The crisis itself is gonna escalate as long as the inflation rates is gonna keep rising. And as we all know, we expect this since the last devaluation, and right now we're expecting another liberalization in the exchange rate, and we know that there's a lack in the foreign currency. So we are expecting that will be actually the crisis is not gonna decline, it's gonna increase more and more, except if the government takes quick actions. And regarding the data, actually, it's not about the lack of data itself. It's about the availability of the data. For instance, the hikes and DHS, they have information about the nutrition, especially the hikes. It has information about the calories intake. It has information about the type of food that the children take, and so on. But this data is not available. This is the problem. We can definitely get a very clear picture if we have this data available. Same for the DHS. The latest DHS is not available yet. So once these data is available, I think for everyone actually, this will give a more clear picture of what's going on. One thing more, which might be a good sign, I don't know whether it's a good sign or not, the thing that we noticed actually from the data, that the vegetable share among the poor households with children actually increased during the last 5 years, which is okay. And at the same time, the real money spent on vegetable was constant, in contradiction with the meat and other food items, which is okay. Might be a good sign, especially that the increase in the vegetable prices wasn't as much as the increase in, for instance, the cereal, the meat, and the seafood, and so on. Whether there is a consequences for this or there is an evidence, we still don't know. Definitely, if we have more information about what they ate in the last 7 days, might give us a more clear picture. Thank you.
Thank you, Dr. May. So I saw 2 other hands on this side.
Good morning.
Introduce yourself as well. It's working.
Hi. Same problem. Thank you. Morning. I'm Rahif Ayab, work for the Protection Net. Thank you to UNICEF and the ERF for the invitation. Jeremy were mentioning this research effort is part of a SDG project that we're working on along with the WFP and IOM. And I think the keyword today was data. Everyone was talking about data, and I think data is essential, especially if we want to work evidence-based. We're specifically working on measuring the impact of as IOM, we're specifically working on measuring the impact of the Ukraine crisis on vulnerable migrants. And the idea is not just to get data. Data isn't the end goal, right? The idea is to utilize the seed funding that we have for this project and see how we can use this data to mobilize further resources from whichever entity to strengthen the protection services we're providing to migrants in Egypt. And ideally, this will take 3 forms. The first form would be increased direct assistance. It can be via cash, voucher, food item distribution. On a more medium-term level, how can we increase the resilience so that they're able to provide for themselves and not rely on any foreign intervention to provide for them? So that can be further education grants, trainings, providing them with vocational skills that they need to generate their own income. As we all know, a lot of migrants are here on an irregular basis. And this means they don't have access to the regular employment channels, and they form part of the informal market. And so they're the most susceptible as well to any economic shocks because they have no rights, no benefits, and they're working there on a day-to-day basis. So how can we empower them? And then the third level is, of course, policy level, governance level. How can we advocate to the different government entities, ministries on increasing their participation in national protection systems, access to public services such as education and healthcare. We already know there's certain level of access, but as a colleague from UNHCR was saying, this remains differential. Access is not equal. It's still nationality based, and there also is lack of awareness in some sectors of the government about the rights of these persons to enroll or take part of these services. At the same time, we need to remain mindful that when we talk about vulnerability, it's not only migrants who are vulnerable. There is a large portion of the Egyptian population who is also vulnerable. And this also puts lots of strain on the national protection systems, which are insufficient and still need a lot so that they can fully serve the migrant population, but also the Egyptian population at large. And so the coping mechanisms or the lack of will not only affect migrants, but also Egyptians. So if we want to look in a migration lens at things, it's also important to see how will this affect irregular migration from Egypt of Egyptians and migrants towards Libya, towards Europe. If we look at most recent numbers, and I'll just give you a few, there's a 77% increase in arrivals in Europe compared to last year. 21% of all migrants in Libya are actually Egyptian. We're seeing a 59% spike of Egyptian and Tunisian migrants trying to get to Europe through the Central Mediterranean route. Last year alone, the Egyptian Ministry of Defense reported 27,000 irregular entry attempts into Libya. And these are the only ones that were detected. So in different European capitals now, we're already hearing that this is very reminiscent of the crisis in 2015. The numbers are increasing. We're not yet seeing the shock in terms of numbers of migration because the impact of the crisis is still yet to be fully seen, but we can already expect that irregular migration is on the rise. And the question is, what measures can be put in place to try and treat and mitigate, and not only in Cairo and in the urban areas. When we're talking about vulnerability, we're also looking at rural areas which don't have the same level of access to social protection systems. So what can we do as government, international organizations and stakeholders from now to try and stem this before it becomes an issue as big as 2015. Thank you.
Thank you very much. Maybe one last question from the floor.
Yeah, thanks a lot for giving me the time to speak. I'm Atif Shabrawi from Ministry of Social Solidarity. I'm advisor and manager of FORSA program. I have just 2 questions for Mr. Scott and Dr. Iman. I'm really appreciating, I will speak about the economic issue. For Scott, I guess I share absolutely what Dr. Sarah mentioned regarding untapped source of fund. I will start by saying that I participated in 2018 in UNDP headquarters for a mission about untapped source of funding for SDGs. And at that time, we did a report about Islamic finance, Islamic economy, and how can we untap the source of fund. And Malaysia and Indonesia are starting to work immediately in 2018, 2019. And I guess UNDP has a separate report on funding SDGs by Islamic finance in Malaysia. So my first question to Mr. Scott, we heard about, I mean, we have to think about the expression alternative, and I'm absolutely sharing all who are speaking about alternative. I'm sorry to mention that we have to think in alternative policies, alternative finance. Everything should be alternative. Everything today should be a plan B, because with my respect, the thinking about conventional funding, conventional finance, the governmental funded reform of fiscal. Egypt is trying to do fiscal reform since 2 decades. So we have to be pragmatic and think on the ground. I guess probably UN, who is already facing a problem in funding its operation and its multiple agencies worldwide, have to refocus in helping countries like we participate in COP27, and we have seen that the question of funding climate change, the question of funding finance is now a real issue. Whatever policies we think about, we have to think about how to finance them. So probably we have to know exactly what are the thinking of the UN and this system of funding, whatever the crisis is, whatever is the impact, and particularly in a new finance way, blended finance, you know, all the alternative finance, which should be one of the promoter of what we have to change the situation, because the government will not sustain its own budget to whatever change we are proposing. Proposals should have a comprehensive way of thinking about, particularly from where we will bring the money. And I share again that untapped source of funding. We have plenty of untapped source of funding. Probably UN agencies should think about it and stop, sorry to say, stop thinking about the conventional way of telling the government you have to, you know, reform that and make more taxes and reform taxes, because it doesn't happen in that way with a country with about 70% of people are informal sector. The first question. The second question for Dr. Iman, I'm really, Dr. Iman was my colleague and we met here in the Ministry of Social Solidarity. Since 3.5 years, I'm turning in all the governments in Egypt. I visited 27 governorates. I wouldn't tell that from the Halab Shalatin, I'll tell Dab'a. I know I have a problem. You mentioned improve the productivity of farmers. I wonder your program doesn't have improving the productivity of the government itself. I mean, I witnessed the duplication, minimum duplication. I wouldn't say that triplication of programs. I will take one example, Haya Karima, which is, as I share, Dr. Sarah mentioned, it touches the life of about 2/3 of the Egyptian. It creates jobs, but we don't see the jobs because it's not coordinating. I mean, I mentioned one example, the Indian program, Mahatma Gandhi Rural Employment Program, which is massively ensuring all public works to be managed in a collaboration with Ministry of Rural Development and Social Affairs. So all created jobs, created certain number of working days for all the society, the community. So probably we think about the policy, who will be forcing the government bodies. I'm sorry, I work in several governments in the Gulf, and I know there is a coordination forcing all the partners to collaborate, because we need also not only our own desire to collaborate, but we need a framework. So probably Dr. Iman can tell us if there is any effort to improve the productivity of the coordination, because coordination is an issue. In FORSA program, we do economic inclusion. We contract, a sample example, we contract NGOs to deliver the intervention with a certain cost, which is 7%. We have several governmental organizations who are giving them for the same job twice and 3 times that cost. So we are not able to mobilize the implemented agency, who are the NGOs, to do the same jobs, which is our neighbor is mandated to do, because we don't have the same policy. We are very strict in budget. Others are not, because others are using donation or other using UN money directly. So probably the issue of coordination is crucial today, because we don't have much resources. We don't have much of time. UN agencies' contribution financially is less and less and less. So probably the government budget as well is contracted. So probably it is a major, I mean, important policy, but also force majeure issue where we have to coordinate and mobilize and maximize the resources. Thanks for giving the time.
Thank you very much. So a very rich set of comments and questions. We are running out of time, unfortunately. So maybe may I ask the speakers for very brief reflections from you, 2 minutes each, just on very key issues as you see, and maybe reverse the order this time, starting with Dr. Iman.
Dr. Atif for your questions, and I think I am. Okay, thank you so much for all speakers and questions. And Dr. Atif, I'm also missing your intellectually challenging questions. So thank you so much for putting on the table a very important point regarding the multi-sectoral coordination. And from our side, for example, if we talk about this like food emergency and the project, we are having different cooperations that the agriculture team is having with the Ministry of Agriculture, also Ministry of Supply and Internal Trade are heavily involved in the same project. So it's like highlighting again the very important points that you made regarding the multi-sectoral coordination with different stakeholders, because it's about not only one ministry that should be implementing, but it's touching different partners. And also, again, we are back to the same point made this morning by Dr. Tariq regarding the involvement of different stakeholders. And I guess Dr. Sarah Eid also touch upon this multi-sectoral importance. Maybe another quick reaction, and I guess this is also seconding the point made by Dr. Mirvat regarding database in order to avoid the duplication of service delivery. I guess the automation of services in itself and having the database and coordinating the database between the government, civil society, and different stakeholders will also improve the ability to reduce this duplication. So these are just quick reactions from my side. Thank you.
Thank you. Over to you, Scott.
Thank you very much, and also let me thank the authors, Dr. Mai and Dr. Nesma, I think, for the report and also for conducting this exercise. It's a very healthy intellectual process, and so thank you very much. Just on the point on the financing approaches, I think to the colleague from Moss and to Ministry of Finance, I think we're actually on exactly the same page. I think that if that didn't come clear, I apologize. But just to be clear, I think all alternatives are absolutely on the table. And I think that they kind of go in parallel. When we think about the traditional revenue sources, that's one thing. How you use your money is a second. But the third piece, which maybe I didn't emphasize enough, is about new sources of revenue. And so I think in the broader discussion around financing, this would include things like the green bond. This would include the debt swap discussion, which was a big piece of the COP27 financing work. It includes things like the impact investment and trying to bring private sector investment funds. I think all of those things are absolutely a part of this overall financing, let's say, financing envelope. And on the UNDP or the UN side, we've had for the last 2 years a joint program with 5 different agencies looking at exactly this this entire resource envelope, let's say. So it's been UN Women. I know we have UN Women colleagues here, UNICEF, UNDP, ILO, and UNCTAD, which were looking at the entire system around financing and all different types of flows. So it was certainly not limited to only public domestic resources. This is coming to an end in the coming months, but this is kind of where a lot of the UN support around developing not only green bonds, but also social bonds were coming out. There was a lot of work around illicit financial flows and about tracking as another way of unlocking additional resources. I think just to sum it all up, I think that we agree completely. And I think that this wasn't meant to say that this was the only source of revenue, nor that it was the only place where the UN system would be supporting or emphasizing. I think the limitation was more on the idea of a short-term impact on our short-term response to the I won't say crisis, to the current situation, and about what the potential funding sources might be for that. So that's one thing. So I think that I think we're very much aligned, actually. On the second, I think I do take the point on very clearly from different colleagues on both the use of the available data and making that data available. I think that those are critical pieces of this this overall data discussion, because I think you spend a lot of resources and spend a lot of time on collecting the data, and then if it's not used, it doesn't serve the purpose. So I think that would be the last point that I would add. But thank you to all the colleagues for the comments, and thanks to the organizers.
Thank you, Scott. So I think a very rich discussion and set of recommendations for the policy part of the paper. Thank you again, Dr. May and Dr. Nesma. I think we can go on for a long time, but maybe I'll just try to highlight 5 key points that I took away as being relevant to the policy part of the discussion. The first is, I think, a number of speakers and colleagues in the room highlighted the magnitude of the crisis, which requires a certain boldness in the policy responses that are being enacted, which is already happening, but I think continuing to call for that given the scale of the crisis, which is, yes, a food security and nutrition crisis, but it's also an education crisis, a health crisis, and so forth. And particularly as what Dr. Tawfiq was saying, that this is a crisis that can have irreversible impacts on children, on their cognitive, mental, and physical development. So to bear that very much in mind as part of articulating policy responses. Second, a lot of very, very good comments in terms of evidence. Scott, I really liked your point about not letting the perfect be the enemy of the good when collecting evidence to inform responses. And I think that means a set of pragmatic actions to be taken in generating evidence to inform policy responses. There was the issue about the availability and transparency of data that is being collected to be used. Actually, there is data available. It needs to be accessible and to be used to inform policy responses, linking various systems of data that already exist and so forth. But then also the point that Dr. Iman, you made about in the paper, the need to maybe highlight the transmission channels a bit more clearly so that we can draw policy conclusions based on those channels. And as Dr. Mervat was saying, the need to also generate evidence on the strength of systems to respond to the crisis, right? So the shock responsive assessments and so forth. The third set of issues, I think, clustered around this issue of, given the magnitude of the crisis, the multi-sectoral and integrated responses needed. It's not just about, of course, the coordination is a very key aspect of that, but also engaging the population and getting feedback from citizens in terms of informing those responses, as being done with the Budget Transparency Initiative, but at a broader level, I think in informing the social policy and economic policy responses will be key, the communications, the behavioral change communications, and so forth. I think the fourth set of issues from a policy perspective related to the issue of preparedness. As we see, the paper highlights how this is coming in a sequence of crises impacting Egypt, and this unfortunately won't be the last one. So the importance of preparedness in terms of delivery systems, for example, again going back to information systems, registries, being in place to be able to respond, as well as contingency policy measures and fiscal measures being put in place to respond to that. Also looking at issues with regards to supply chains of in agriculture and food systems as part of that preparedness, but also the multi-sectoral response. And I think the last issue, the last set of issues, the bucket of issues, I think related to the issue of spending, social spending, and the need first to ensure that primarily it still needs to be tax based, to be sustainably financed, but not ruling out alternative and innovative sources of financing that are catalytic and complementary, but not replacing, government financing. But at the same time, from the social sector side, to make the case for this financing to happen. I think it needs a holistic view so that one sector is not coming in competition or seen as coming in competition with the other. And there's strong evidence to make the investment case, the cost and benefit of increasing social sector spending and actually, gaining efficiencies within existing social sector spending. And I think the point about transparency and engaging the citizens in terms of that is going to be key. And actually one point that is perhaps also critical, and then, from the fiscal and the integrated policy response, is the angle of leaving no one behind, particularly migrants, refugees, and asylum seekers, from both the policy side, but also the fiscal side. And how can development partners and donors also contribute to ensure that social policy and social protection responses are truly inclusive in that sense? So thank you very much. A round again to our wonderful panelists and everybody contributed to the discussion. So Dr. Shireen, I know it went a few minutes over time, but I think it was worth it. Back to you.
Very much worth it. Thank you very much for a very rich discussion. And I'll give the floor to Dr. Ibrahim Al-Badawi for the closing remarks and next steps.
Thank you, Shireen. Dear distinguished participants and partners, I want to start my remarks by thanking all of you for your valuable contributions throughout the 2 days of this timely policy dialogue. Your engagement has made the discussion extremely insightful and rich. I believe we have achieved our end goal of this roundtable, which is to enhance our understanding of the impact of the war on Ukraine on issues related to households and children, thanks to your participation and insights. In terms of the next steps, we will work on incorporating your comments as well as that of the commentators and panelists into a revised policy brief in order to have a final draft ready, hopefully by the end of this month. The policy brief will be published and circulated and shared with our networks. Moreover, we will initiate the work on the second component under our partnership with UNICEF, which focuses on the inclusiveness of social protection systems and how it affects non-nationals, immigrants, refugees, and asylum seekers. We will start by drafting a set of policy papers addressing the most important issues related to this subject. An initial consultation with stakeholders will be done early next year to frame the questions and the topic of the papers, which will be published jointly with UNICEF and following by the dissemination and engagement activities. Let me actually, before I come back and conclude with regard to this particular project, thinking ahead in the future about potential research and policy discussions is to actually stress the importance of the national economic narrative or national narrative for addressing potential implications for social cohesion. Because in time of adversities and when there are economic disparities or even horizontal social inequities, these kind of shocks are likely to have huge implications beyond livelihood and economics and poverty, and it might actually affect political institutions and stability. So I very much second the intervention by the colleague from the Ministry of Finance about the national economic narrative. It's very important to explain to the public what the government is planning to do, and also to prepare them to appreciate some transitional cost en route to the potential medium to longer term solutions. So I think this would be very important, and some political economy and political dimension and expertise from that dimension, I think would be very useful to incorporate in any kind of future follow-up. The other thing is regional cooperation and reshoring and pooling competitive advantage across countries in the region. I think would be very important, because it's very likely that one of the key lessons of the Ukraine crisis is that regions will try to acquire some level of competency and capacity in terms of food supply chains, and so it's very important for this region also to think about this and for the policy dialogue to account for this. Finally, I have a question which I'm not sure is fully addressed, which is the role of cooperatives, because especially when markets are not complete and there are shocks such as the shock to the supply chain and prices and so on, there will be some actors who will try to game the system. And so I was wondering whether we have any data on, but we could actually, I think, do some cross-country comparisons. In those countries where, or in those societies where cooperatives are robust, are the price shocks propagated the same way as countries where there are no cooperatives? Because I think even in advanced countries, cooperatives play a very significant role in actually acting as price stabilizers, because cooperatives tend to benefit from the collective resources and the scale, especially when they actually transcend or actually pervade the scale from the producers cooperatives to the consumers cooperatives, and therefore they pool risk. So I think this is maybe an area that might be of interest to consider. Finally, let me just kind of thank our partners at UNICEF Egypt for all their support and amazing team spirit. We are very pleased this partnership happened, and we are confident that the outputs of this collaboration will be of great benefit to all stakeholders. We thank you again for your continuous engagement, and we hope to see all of you in the future events. Thank you.
Thank you very much, Dr. Ibrahim. I think it's been rich 2 days, a lot of food for thought, fantastic input. We're really grateful. We've tackled the issue from different perspectives, and Dr. Ibrahim also included some new thoughts, themes, and we've been talking to our colleagues at UNICEF as well in terms of next steps and how we expand the partnership to look into different new aspects. I'm really glad to have had you all on behalf of ERF and my colleagues. I would say, and now I feel it's friends, ERF and UNICEF, because we've been working closely with the team there. Long hours, Lina, Francesca, Yasmin, and Amatullah, Namis, and Hoda. It's been really great. We're scratching the surface, as it's very obvious, and looking forward to next steps together and an ever expanding agenda of work. Thank you very much. And please join us for some coffee and snacks and a chance to actually get to know each other a bit better. Thank you very much.